A silent epidemic is claiming lives prematurely in Malaysia, and it has been for a number of years now. Non-communicable diseases, or NCDs for short, have cast a shadow over the well-being of Malaysians and the resilience of our healthcare system. In 2022, nearly a quarter of the country's premature deaths were attributed to NCDs. That year itself, more than 90,000 deaths were recorded among adults aged between 30 and 69, below the national average life expectancy of approximately 75. A closer look at pre-mortality data from 2015 to 2022 revealed that heart and cerebrovascular diseases, along with pneumonia, have been the leading culprits behind these premature deaths. Even during the height of the pandemic, these NCDs continued to be major causes of premature death, second only to COVID-19. At some point in 2015 and 2016, young adults were more likely to die from NCDs than from road accidents. Although minimal differences were observed in terms of gender, heart disease emerged as the biggest killer for males. Males were almost twice as likely to succumb to the ailment compared to females. But why have NCDs continued to affect adults in their prime in the last 7 years? Dr. Moy Fung Ming of University of Malaya's Faculty of Medicine says it is all down to lifestyle choices.
Cerebrovascular disease and ischemic heart disease is lifestyle-related diseases. So, as we all know that from the NHMS results, the rate of obesity is increasing. The prevalence of diabetes also increasing, as well as the prevalence of hypertension also remain high at around 30%. So, with all these risk factors, lifestyle-related risk factors, it will contribute to the higher risk for ischemic heart disease.
And if the trend in NCD prevalence does not improve, Moy says the healthcare system could face a substantial burden that would in turn affect the national economy.
When you have more patients, right, the healthcare system, the government would need to provide more facilities to treat the additional patients. If our people they get these diseases when they are still in their still productive, that means still working age, then it will reduce the productivity of the place that they work and then of the country.
But Moy says it's not enough to just have good healthcare facilities and services. People must take responsibility for their health.
If they're obese, they should reduce weight and so on, be physically active. If they don't do that, so they would have all the risk factors, and which this will predispose to more of our people getting these diseases.
Moy also says other ministries, such as the Local Government Development Ministry, can also play a role in preventing NCDs.
So like developing a city, the housing, all this I think need to be considered. Like when you develop a new residential area, you must have enough greens or parks for the residents to exercise and all.
The numbers are stark, and the impact on individuals and the nation's healthcare system cannot be overstated. It is crucial that people take charge of their health and for various ministries to work together to ensure healthier lifestyles. It may not be easy, but efforts must be made to stop NCDs from claiming more lives. Danish Rajareza and Lanel Tam, FMT News.